Today we're going to be discussing Hipaa, which is the Health Insurance Portability and Accountability Act. Hipaa limits the sharing of protected health information. It restricts employers from using protected health information in employment decisions. It also requires employers to adopt and apply procedures to safeguard protected health information. There are several rules under Hipaa. The privacy rule protects individuals from discriminatory or wrongful use of their protected health information. The security rule safeguards protected health information through security officers and security measures. The electronic transactions and code set rule sets standard codes for electronic transactions. There are penalties for Hipaa noncompliance. For knowingly misusing personal health information, an individual can receive up to 1 year imprisonment or a $50,000 fine or both. For obtaining personal health information under false pretenses, an individual can receive up to 5 years imprisonment, a $100,000 fine, or both. For using personal health information for commercial advantage, personal gain, or malicious harm, an individual can receive up to 10 years imprisonment or a $250,000 fine, or both. Under Hipaa, clients have multiple rights. They have the right to have their personal health information protected, to inspect and copy their records, to request their personal health information records be corrected or changed, to request limits on how their personal health information is used or shared, to request the manner in which to be contacted, and to get a list of disclosures made of their personal health information. Providers are required to give a written notice of privacy practices that explains how they use and share personal health information, clients' rights, and entity responsibilities regarding personal health information, and who to contact for more information. The written notice of privacy practices is provided at the time of first delivery of services, or in an emergency, it's provided as soon as practical after the emergency passes. The written notice of privacy practices is posted at each physical site of service and is posted on the agency website if they have one. It is also available upon request by anyone at the physical site of service. The agency must document failed efforts to obtain written acknowledgement that an individual has received the written notice of privacy practices. Some examples of non-protected personal health information are pre-employment physicals and/or substance abuse screenings, information needed for the Family Medical Leave Act, information needed for the American with Disabilities Act, and information required for disability retirement or retirement savings plan withdrawals for health reasons. Some examples of protected health information include names, addresses, all dates, telephone and fax numbers, email addresses, social security numbers, photographs, account numbers, medical record numbers, health plan numbers, license and vehicle identification numbers, diagnosis and medications, and any other unique identifying number, characteristic, or code. Minimum necessary refers to the amount of personal health information used, shared, accessed, or requested must be limited to only what is needed. For example, when a billing company bills for a blood test, it does not need the client's complete medical record. Covered entities under HIPAA are healthcare plans, healthcare providers, including doctors, nurses, therapists, and people who transmit information electronically, organized healthcare arrangements, hospitals and clinics. Any non-employed vendor providing a service for the covered entity where access to personal health information is needed must sign a business associate agreement promising to keep the personal health information confidential. Prior written authorization. Do not use or disclose personal health information for any non-routine purposes without prior written authorization signed by the client. The prior written authorization form must include the following: the name of the person or persons authorized to make and receive the disclosure, a description of the information to be disclosed, the expiration date, and a statement that the authorization can be revoked at any time, and the client's or legal agent's signature and date. Prior written authorization is not required for the following: to treat a client, to get paid for treatment, or to evaluate the person who provided treatment, to share protected health information with the patient, to report births and deaths for public health purposes, to report abuse, neglect, or domestic violence, for organ, eye, or tissue donation, and for coroners, medical examiners, or funeral directors. Prior written authorization is required for marketing and fundraising, for use and disclosure of psychotherapy notes, and for use and disclosure of research. Here are some frequently asked questions regarding HIPAA. Is personal health information the same as the medical record? The answer is no. HIPAA protects more than the official medical record. A great deal of other information is also considered personal health information, such as billing and demographic data. Even the information that the person is a patient is protected health information. Question: what if I am accidentally overheard discussing a patient's protected health information? Answer: it is not a violation as long as you are taking reasonable precautions and were discussing the protected health information for a legitimate purpose. The HIPAA privacy rule is not meant to prevent care providers from communicating with each other and their clients during the course of treatment. Question: if I overhear patient care information in the elevator or hallway, how should I handle it? Answer: if appropriate, remind the speakers of HIPAA policies in private. If the conversation clearly violates policies or regulations, report it to the agency's privacy officer. Question: if I work in a hospital, nursing home, clinic, and I don't need to access protected health information for my job, but a client's family member asks me about a patient, what should I do? Answer: explain that you do not have access to the information and refer the family member to the patient's healthcare provider. Question: what if I get a phone call looking for information and the caller says he or she's the patient? What should I do? Answer: if the request is made by phone and the requester identifies him or herself as the client, you can ask him or her to provide personal information for verification, such as a birth date or social security number. Finally, question: as part of my job, I have access to protected health information. How do I know which family and friends can be told this information? Answer: always ask the client who can receive protected health information and document the response in the patient's medical record.